All right, from now on, we start the webinar. No more noise, no more sound. Thank you.
Healthy beginnings, hopeful future. That is such an optimistic way to mark World Health Day as we gather together to bring global action for women and newborns. My name is Femi Oke. I am your moderator for the next 75 minutes. Let's start with a reminder of why we are all here.
Mama, I love you. You hold me, you keep me safe, you are my world. Not every baby gets this chance.
Every 7 seconds, a mother or baby is lost to causes we could prevent. Not enough midwives, not enough medicine, not enough time. But this can change when we invest in science, in strong health systems, in equality, when we make the choice to support mothers and babies, when birthdays are moments of hope, not loss. We protect the future, because every healthy beginning means a hopeful future for us all.
Mama?
Welcome, everybody. If you're joining at the WHO in Geneva, if you're joining remotely on Zoom or on YouTube, it is so good to have you. On Zoom, we actually have our entire session in multiple languages. So go to the bottom of your dashboard and you will see a little section that either says interpretation or more. Click on more. Find interpretation, and then you will see the number of different languages that this session will be available in. And then you will hear me speaking perfect French or Arabic or Spanish or Portuguese. So that is how on Zoom you can hear our session in multiple languages. It is so good to have you. Let me tell you the plan for today. We're going to unpack the challenges for women and newborns around the world, making sure that their health stays intact, that they have a healthy future. We will look at where we are now, what is the data telling us, and we will get solutions from experts and guests. And there is a phrase that you will hear. It has an acronym, but I love the phrase so much. Every woman, every newborn, everywhere is an initiative that brings together over 50 countries and 3 UN agencies to accelerate the improvement of care for women and newborns. Every woman, every newborn, everywhere. The 3 UN agencies who will be co-chairing this initiative, the WHO, UNICEF and UNFPA. You will hear from all of the heads of these agencies in the next few minutes. We start with Dr. Tedros, the Director General of the World Health Organization. Happy World Health Day to you, Dr. Tedros. What do you have to tell us?
Thank you, Femi. Dear colleagues and
Hello, everybody who is watching on Zoom. I appear to have a technical issue. So this is one of the challenges of connecting globally and via the internet and virtually as well. So just give us a moment. We will work on this as soon as possible. We will reconnect with Dr. Tedros and we will continue our session. But thanks for your patience. I will come back with more information as soon as I have it. In the meantime, you get to look at my face. So I apologize about that, but it's nice to see everybody who's gathered from around the world. All right. So we are trying to reconnect with the WHO in Geneva. Who thought that that would be the weakest link? That's extraordinary. Let me remind you of some of the conversations that we have coming up. We will reconnect with Dr. Tedros. You will hear from the heads of UNICEF and also the heads of the UNFPA for our co-chairing initiative, which is every woman, every newborn, everywhere. We will then get some data. Where are we right now? Fresh data. What is the current situation? And then we will go into 2 mini panels. And I love the first panel. Actually, I love the second panel as well. The first panel is talking about solutions coming from on the ground. You know, the solutions often get pushed to the last minute of a conversation, of a session. But our solutions will be at the beginning. We're starting with the solutions because we need to accelerate the health of women and newborns. And then the second session, which is even more important, well, they're jointly important. I can't elevate one over the other, is about partnership as a way to implement the solutions that we're going to share with you. It's possible that we might actually have this entire webinar without the WHO in Geneva if we're having trouble reconnecting, because we've got so many of our expert speakers right here online in the Zoom room. So we will have a boutique conversation. That is possible. Let's see what is possible to do. And then, of course, we will talk about action. No session is complete without saying, okay, we've talked about this. Now, what do we do? So again, I will remind you that, as if you needed reminded, because this session is not all about me and you're seeing a lot of me right now, is that we have a technical issue connecting with the WHO in Geneva, which is where Dr. Tedros is. It's where we heard the very first part of his opening remarks, and we didn't hear anything else. else. I will check with the team. So give me a moment to do that. So you will see my face concentrating, but I will mute myself so you can check on, actually, you can check on your email. I wasn't going to tell you that. Check on your email, check on your messages, and then, but keep the Zoom open, keep the stream open, and I will be back with more news for you in just a moment. But I'm just going to mute myself so I can focus on how do we fix this? Because if nothing, we are troubleshooters if we work in maternal health with newborns. Okay, back in a moment. Do stay with us. Thank you. All right, so in this session, we have two panels. And the first panel is going to be a really important panel. We actually have all of the panelists here. So I'm actually going to say hello to them and get them to introduce themselves, as we are starting this a little bit earlier than we were anticipating, but we're adapting, which is what we need to do whenever we talk about some major health challenges. So I'm going to go to and bring into our conversation our three panelists that will take us into solutions. What are the solutions for how we approach and accelerate the care that women and newborns need? In our conversation, we have Dr. Bibek, Director of Family Welfare Division, Department of Health Services, Ministry of Health and Population in Nepal. Dr. Parajita Gogoi, Executive Director, Centre for Catalysing Change and co-chair of the White Ribbon Alliance Global, and Professor Caroline Homer, Director of ARPAN's Centre for Research Excellence at the Burnett Institute, on behalf of the Western Pacific Regional Office of the International Stillbirth Alliance and the Australian Stillbirth Centre of Research Excellence. Caroline, I know, Professor, you do not have that on your business card. That would be impossible. We are going to accentuate the positive in our conversation today. Dr. Bibek, hello. Please say hello. Please greet our Zoom audience, our online audience. Welcome.
Hello, Femi. How are you?
Very well, thank you. Rachel, good to see you. Lovely to have you as well. But also, I'm going to go into Dr. Gogoi. Hello, Dr. Gogoi. Welcome.
Hi, Femi. Very good to
Hi.
be here.
And Caroline, welcome. Thank you so much.
Hi, Femi. Hello, everybody. Thank you so much for being here this evening, this morning, this afternoon, wherever you are.
Yeah, because we're all over the world all of the time for this session. So let me start, first of all, with Dr. Bibek, because you're in Nepal and you have done something pretty extraordinary, which is with limited resources, you are looking at how you can care for women and newborns in a better way, in a healthier way, so more people survive that critical point of life. What are you doing? What can you share with us that help us understand what is possible from the Nepalese perspective?
Thank you, Femi, for that question. So I'll let you in on a secret. That is, like many other low and middle income countries, we also struggle to secure sufficient funds from our national budget. Just to give you an idea, our budget share in national annual budget would be around less than 5% generally. Okay, but what I think my colleagues and predecessors over a long period of time have done smart is that they have prioritized more resources for the maternal and newborn health program out of the available budget. And we have also had very good, I think, foresight where the legal and policy structures were in place so that we could move it forward. We have also been very fortunate to have support from bilateral, multilateral, non-governmental organizations as well as the community-based organizations. And when it comes to programs, we have been fairly quick to adopt new evidence-based recommendations that comes from organizations such as WHO, UNICEF, UNFPA, and others as well to improve the maternal and newborn health in our programs and policies. So all of these have been, I would say, useful in getting us where we are today. So if you'd like me to go a bit deeper, then I can talk about some of our legal and policy environment, or would you want me to stop there?
Go a little deeper, and then I'm going to go to Dr. Gogoi, but just a little deeper. So tell us a little bit more. We're leaning in.
Thank you so much. So starting with our constitution itself, it enshrines the rights of every citizen of safe motherhood and reproductive health as their basic rights. And we have got further laws which clarify these, where all these services related to safe motherhood and reproductive health are part of basic health services, which every citizen is entitled to get free of cost. So you can understand how much of a burden that is that we have taken upon ourselves with the given limited budget. And also, we have got our long-term health policies, plans, safe motherhood and newborn health roadmap that we have developed towards achievement of our SDG goals. So all these have been very helpful in terms of legal and policy environment. And we have also had a very good package of interventions directed towards pregnant mothers and newborn babies. So we have been incentivizing women to come for antenatal checkups. They are provided some transportation cost. Every services related to pregnancy and delivery are free, including up to the cesarean sections. They are entitled to receive free postnatal care. Even transportation is free. And we have a very robust, what we call maternal and perinatal death surveillance and response system, which looks after these deaths and what we can do to prevent such deaths in the future. And we also have a free newborn care program where all the services provided to care for a newborn with medical needs is free of cost. The parents are not supposed to bear any cost, and the hospitals are reimbursed the cost. So just to give you some idea on these, and we have also had
amazing. That's extraordinary. And there's more to share, obviously. Thank you so much, Dr. Babek. I'm going to pause for a moment there because I want to bring in Dr. Gogoi, because one of the challenges that we're having right now, always have, but where does funding come from? How do we get more funding? How do we fund initiatives that really need to help women and newborns? And so what I wanted to ask you was really about specific interventions that we can use to prioritize the progress. What should be at the top of the list? What should we be top of mind that we should be thinking about, Dr. Gogoi?
Thank you, Femi. Hello, everyone, and greetings on the occasion of World Health Day. Thank you for the question on protecting progress, but I also want to talk about what could quicken progress, because we really need that. And I also want to talk about the fact today, I know everybody would be talking about what health systems, health ministries can do, but I want to talk about solutions coming from beyond the health system. Of course, strengthening health systems, strengthening quality of care, ensuring access to family planning, reproductive health, everything is really, really important. But the challenge that we have today is systemic inequities. And you all would agree that if we want to solve systemic inequities, we have to address factors like gender discrimination, poverty, harmful cultural practices, because these are what is harming the most vulnerable women and girls, and that is where progress is stalling. If you look at all the progress that we have made around the world, the quote unquote, the low-hanging fruits are gone. It's going to be increasingly difficult to reach the vulnerable women and girls. So my solution is that we have to prioritize equity, education, and systemic reform. And how do we address systemic inequities? We have to go beyond health, like I said. We have to look at women's economic empowerment. How do we provide women in our countries income-generating opportunities, microloans? How do we help them transition to a labor force? And Femi, so many women that we meet in the communities, they tell us that if they had their own money, if they had control over their own money, they could have taken decisions, better decisions, life-saving decisions. Again, to address inequities, again, beyond health, we have to invest in girls' education because we know there is global evidence that educated girls exercise better contraceptive choices, delay marriages, and we know that all of these lead to better maternal and newborn outcomes. So yes, solutions must look at harmful gender norms, girls' education, social norms like child marriage. And I think because we are focusing today on vulnerable women and girls and children, I think we have to remember that women who are in the marginalized communities, they have overlapping vulnerabilities. No agency, early marriage, could be school dropout, no education, no economic power, facing violence on a day-to-day basis, not able to seek care. And that's the reason why I am making my point here that for solutions, we have to go intersectoral. And my last point here is that it's really, really important to amplify marginalized voices because vulnerable groups, especially women in rural areas, in crisis settings, I think hearing their voice is really, really important because they can provide us unique perspectives on how health systems either fail them or support them. And I want to take a second to talk about the What Women Want campaign, where the White Women Alliance asked more than 2 million women across the world about what is it that they want, what is their top priority. And we listened very deeply to their needs, their aspirations, and we acted on what women are asking for. We mobilized women, communities, advocates, but we ensured that solutions are being led by local decision makers. And just to share with you, this particular campaign, What Women Want, it has resulted as of today in impact at multiple levels. Around 40 policies have been changed or informed or propelled by What Women Want demand. More than 300 million USD in new funding has been mobilized because women asked for some of these. Thousands of health workers have been recruited, thousands of facilities have been upgraded, and the impact of amplifying the voices has been local, national, even global. So I would like to end by making a case that if we want to not stall progress, we really have to look beyond the health sector. We have to center communities' voices, women's voices, so that marginalized groups, marginalized women and children are not left behind. Back to you, Femi.
Thank you, Dr. Gogoi. If you have just joined us or you joined us midway through our conversation, you are watching Healthy Beginnings, Hopeful Futures, Global Action for Women and Newborns. We have a few technical issues, but it is not stopping us from having the important conversations that we need to have today. Although I have to say, I'm very sorry for interpretation at the moment. We do not have it. We are trying to troubleshoot that and get it to you. But in the meantime, we continue our panel on solutions for women and newborns, making sure that they have healthy, hopeful futures. Professor Homer, Caroline, when we talk about midwives, they are really at the front line of action and help and support, not just for newborns, but also for women and families who sadly experience a stillbirth as well. So when we're talking about practical solutions, what comes from the midwifery community? What would you want to share with us?
Thank you so much, Femi. And yes, there are many great solutions, and both my colleagues who've just spoken had some really fantastic solutions. We know there's a lot of great interventions that we can do with women, with babies to make sure that they have these healthy beginnings. But we have to have a workforce to deliver them. And so this is where midwives are so key, because without midwives, without a health workforce, you just can't deliver the things that we know women and babies need. We know from a lot of research from around the world that midwives are really important in providing quality care and reducing these preventable deaths. Some work that I did a few years ago showed that if we had universal midwifery coverage by 2035, we could avert over 60% of maternal and newborn deaths and stillbirths. 60% is a very big number. So midwives are a solution, but they're not a solution just to educate them and send them out. They have to be well educated. They have to be well regulated. They have to be part of a system that looks after them, that ensures they have access to a phone to call for help or to consult with other health professionals, especially doctors, pediatricians, obstetricians, neonatologists where they exist. And of course, they need transport for referral. And Babek has mentioned transport already. What I've seen works well in a number of countries is when midwives are recruited from their communities, they're well educated to provide the care that mothers and babies need, and then they're put back in those communities with good support, with access to medicines and equipment to do their job well. But of course, they have to be paid properly. They have to be given good working conditions, and they have to be respected by other health professionals. And of course, they're mostly women around the world, and that has a gender disadvantage as well. We know that leadership is really important as a solution, and so effective midwifery associations in every country, working closely with organisations who are part of FIGO. I think that's really important. Two more points, Femi. One is about midwifery models of care, because in another event today, there's a midwifery accelerator being launched, which is really key for scaling up midwifery continuity of care, midwifery models of care. This is where the woman knows the midwife and they develop trust. There's really good respectful care and support. So these midwifery models of care, you'll start to see more out there in many countries. And finally, sadly, sometimes a loss will occur and can't be prevented. So a stillbirth or a neonatal death. And we know now that bereavement care is essential. And midwives, especially if they already know the woman, are really important to provide this bereavement care. So that includes emotional support, compassionate and non-judgmental support, practical support, and especially talking about stigma of loss. There's physical care. These women have often had very complicated births, and postpartum care is so important, just as our colleague from Nepal said. It's an area that we have to get better at. And then making memories. Finally, encouraging families to create memories and rituals to honour their baby, and using the name of the baby, I think, is so important. So Femi, thank you. Just a few ideas and solutions, and really lovely to have this conversation. Thank you.
It's such a joy to talk about solutions when we have so much to do for women and newborns. And so it's been such an encouraging conversation. I'm going to keep with the optimism, if I may, solutions panel, because the theme for World Health Day is healthy beginnings, hopeful futures. Caroline, so between now and 2030, achieving our goals for women and newborns, what gives you hope?
Look, lots gives me hope, Femi. I think, we are in a tough space at the moment, but even in the last year, I've been really hopeful around the enthusiasm for midwifery models of care, as I said. Last year, WHO released a position paper called Transitioning to Midwifery Models of Care. And today, UNFPA, WHO, UNICEF, the ICM and many other partners are launching the Midwifery Accelerator in New York. This is a global initiative to expand access to high quality care. And next month we'll be releasing an implementation guidance. So there's lots of momentum, I think, and we have to keep on this momentum. And I think the work today that was launched showing a decrease in maternal mortality is hugely encouraging, but we know it's slowed. And we now know we can't slow down. So we have to continue this momentum.
Okay, accelerate the momentum. Dr. Gogoi, between now and 2030 on World Health Day, what gives you hope? What are you hopeful about?
Of course, Femi, the world today is filled with disruptions, funding cuts, policy changes, everything, changing priorities. But I think there's a lot that we can look forward to. And there are many things that I would like to talk about, what civil society organizations are doing and can do more. We have governments, we have WHO, UNICEF, UNFPA, donors doing a lot. But I think CSOs can really bridge some vital gaps because they are closest to the community. They can advocate for equitable policies, and they can really amplify the voices of the marginalized. Because we are there where the most vulnerable populations reside. And I think CSOs can contribute a lot more to the solutions, because we're talking of solutions today, because we are on the ground, we know the realities, and there is an immense amount of commitment. Back to you, Femi.
Okay, good. I like the way this session is going because it is giving us solutions and also giving us hope when it's a really difficult time for anybody who's working in health. Dr. Bebek, one last session of hope from you. What do you want to share with us? What are you hopeful about for the next 5 years?
I would refer to the data that came out today through the publication of the report jointly by all the UN agencies, which show that we are making remarkable progress. And we have seen it through our own eyes, through our own experience. And now we know what works and what doesn't. It is, I think most of the countries you refer to it have now adopted the maternal and newborn health acceleration plan. So we have identified those things and we are going to work on that. And we also have the evidence from other studies, other parts, as well as our own domestic settings where we feel that every sector buys into the idea of better health for mother and newborn. So I think the overall environment is conducive to a better maternal and newborn health in 5 years. But again, I would have a word of caution there is it requires sustained financial and technical support. Many of the countries do not have enough domestic resources to take it to the finish line. So I think we need to have that global solidarity and continue to work so that we can reach where we want to by 2030.
Solutions panel, it's been such a pleasure having you start our conversation here on World Health Day. We really appreciate you. Please stay with us because your optimism will infuse the rest of our conversation. I go now to Dr. Tedros, who is coming live from his office, a change of location. It wasn't expected, but we are adaptable and we can handle it. Dr. Tedros, again, we really appreciate you being one of the co-chairs of Every Woman, Every Newborn, Everywhere. What should we be thinking about on this day when we're focusing on healthy beginnings and hopeful futures?
Did you touch it there?
Dr. Tedros, over to you.
Can you hear me?
We hear you. We
Can
hear
you
you.
see me?
And we see you, which is a miracle.
Thank you.
So we're very happy
you
to do
said
both.
Solutions and hope. And I think I would add to that, don't give up, keep moving. Because we have this technical glitch, and then of course we didn't give up, but we have a solution now. So thank you so much, Femi. But I fully agree with the panel. Solutions and hope is very important. And good afternoon to everyone here in Geneva, and good morning or good evening to everyone joining us online around the world. And happy World Health Day. As you know, World Health Day is WHO's birthday, and today we turn 77. It was on this day, the 7th April in 1948, that the WHO Constitution entered into force. The WHO Constitution outlines 22 core functions of the organization. One of those functions is to promote maternal and child health and welfare. In other words, maternal and child health has been part of WHO's DNA since the beginning. The theme for World Health Day this year is Healthy Beginnings, Hopeful Futures. It reminds us that the way we start life plays a huge role in determining everything that comes after. When women and newborns not only survive childbirth, but enjoy good health, it benefits families and communities and contributes to economic development and stability. Since 2000, the world has made great progress. Maternal deaths have declined by 40%, and newborn deaths by just over 30%. The report we are launching today presents more good news. In 2023, for the first time, not a single country was classified as having extremely high rates of maternal deaths. These gains are being driven by advancements in research and service delivery, which are helping us to address the leading cause of maternal death, including postpartum hemorrhage. WHO is also supporting countries to scale up interventions to increase survival for small and sick babies, including specialized newborn care units and kangaroo mother care. And with partners, we're improving access to skilled midwifery care. None of this work is possible without partnerships, which is why, together with UNICEF and UNFPA, we established the Every Woman, Every Newborn, Everywhere initiative, or EWINI. I'm pleased that the Executive Director of UNFPA and UNICEF, Natalia Khanem and Catherine Russell, my dear colleagues, will also share their messages with us today. EWINI ensures action for maternal and newborn health under one roof, so that we coordinate more effectively with local and international partners in places that need it the most. It's now supporting more than 50 countries to improve access to high-impact interventions and bolster health systems. Stronger partnership is more important now than ever, as we seek to reinvigorate progress towards the SDG targets in the face of a dramatically constrained financial environment. Since 2016, progress has slowed, and every year we continue to lose millions of newborns and hundreds of thousands of mothers during birth and shortly afterwards, mostly from preventable causes. Most deaths occur in the poorest countries or communities, and especially in war zones and other fragile environments. It's in these areas where the recent cuts to development assistance will have the starkest impacts. So let me leave you with 3 priorities as we move forward in these difficult times. First, prioritization. We need to focus on what we know works, scaling up evidence-based practices adapted to the local context for maximum impact. Second, investment. We need to make the case that investments in maternal and newborn health deliver a rich return over many years in the health of children, adolescents, and adults, and in the stability of communities, countries, and economies. Third, partnership. No agency or country can do it alone. We need to work together, learn from each other, and make sure that we engage the communities we serve. Thank you all once again for your commitment to working for hopeful futures and healthy beginnings for our mothers, our sisters, our babies, and for all of us. Femi, thank you again, and back to you.
Thank you very much, Dr. Tedros. We appreciate your insights as we mark World Health Day. Healthy beginnings, hopeful futures. The initiative EWINI that Dr. Tedros talked about, Every Woman, Every Newborn, Everywhere, is co-chaired by 3 UN agencies, the WHO, UNICEF, and the UNFPA. We are joined now via video with Catherine Russell, who is the Executive Director of UNICEF. Catherine, thank you so much for joining us. Over to you.
On this World Health Day, we celebrate the remarkable accomplishments in maternal, newborn, and child health, and the tireless efforts of midwives, nurses, and community health workers in ensuring that mothers and babies survive and thrive. More mothers, newborns, and children are surviving today because of their efforts. Between 2000 and 2023, improved access to essential health services has contributed to a 40% decline in maternal deaths and a 50% decline in child deaths. This is testament to the remarkable results we can achieve through collective efforts. But much more is needed to bring down preventable deaths and improve maternal and child health. As pregnant women, mothers, newborns, and children continue to face unprecedented challenges, including humanitarian emergencies and lack of access to health and nutrition, our work is more vital than ever. Newborns are particularly vulnerable, as almost half of the deaths of children under the age of 5 occur in the first month of life. Without adequate and sustained investment, decades of hard-won gains could be rolled back. Investment in scaling up access to proven life-saving maternal and newborn and child health services is urgently needed now. We have the knowledge of simple, cost-effective, and scalable solutions that can save lives. Skilled community health workers, nurses, and midwives can address complications during pregnancy, provide quality antenatal and postnatal care to support mothers and babies. UNICEF is calling for governments and partners to protect investments in nurses, midwives, and community health workers. We know that progress is possible, and by working together, we can ensure that every mother and every newborn, everywhere, has access to life-saving health services.
One more co-chair to hear from, and that is Dr. Natalia Cunham, the Executive Director of the UNFPA. Dr. Natalia, over to you.
Excellencies, esteemed delegates, colleagues, and friends, on World Health Day, we gather together with purpose and resolve. Because in our world, each and every 2 minutes a woman dies from preventable complications in pregnancy or childbirth. And in places affected by conflicts, maternal mortality more than doubles. Look behind every maternal death, and you'll find a clinic that didn't have essential medicines, a community without skilled midwives, and a crisis putting basic human care out of reach. It's one of the world's gravest injustices. It demands everyone's urgent attention. Maternal mortality is not inevitable. Since the year 2000, maternal deaths have actually dropped globally by 40%. And that is proof of what is possible when we choose to act. We know what works. Top of the list, midwives. Midwives save lives. Yet currently, we face a global shortage of nearly 1 million midwives. That's why UNFPA, with WHO, UNICEF, and other great partners, launched the Midwifery Accelerator, a global blueprint and coalition to fill that gap. We cannot afford to lose momentum. I urge governments to support maternal health. Safe birth is no longer a technical challenge. It is a political choice. Investing in maternal health is both a smart investment and a decent moral imperative. This year's World Health Day theme, Healthy Beginnings, Hopeful Futures, reminds us that the survival and well-being of every woman and every newborn everywhere is the very foundation of strong families, of resilient communities, and prosperous societies. A healthy beginning is a human right for every mother and newborn baby, laying that bright pathway to a safer, healthier, more peaceful world for all. Let's make it happen.
Thank you, Dr. Cunham. You may have heard a little bit earlier when Dr. Bibek was talking about Nepal and talking about some new data and information that we have. He teased the breaking news, the breaking data ahead of Queen Dubé, Dr. Queen Dubé, Medical Officer, Maternal Newborn, Child and Adolescent Health and Aging Department at the WHO, setting the scene. How far have we come? How far do we need to go? What is the data that is important for us to understand and unpack? Dr. Dubé, over to you. Thank you.
Thank you very much, Femi. Can you hear me and can you see me?
We hear you, we see you. Thank you.
Thank you very much. And can you see my slides?
We see the slides too. Thank you.
Fantastic. So over the next couple of minutes, I will take you through what has come out hot on the press from a couple of hours ago and what came out about 2 weeks ago. So about 2 weeks ago, the UN released a report on childhood mortality, but also stillbirth as of 2023. And just today on World Health Day, and again, happy World Health Day, everyone, we had the UN report on trends in maternal mortality released. So I'll take you through the high-level insights on where we are now. Suffice to say that when you look at maternal deaths, newborn deaths, and stillbirth, in 2023, we lost 4,460,000, out of which 260,000 were women who lost their lives whilst pregnant or giving birth. We had 1.9 babies that were stillborn, and 2.3 million newborns lost their lives in the first 4 weeks of life. Very important for us to realize that, yes, the numbers are huge, but we've made progress from the year 2000. When you look at numbers from 2000 to 2023, in terms of maternal mortality, there has been a 40% decline. On the newborn mortality, there has been a 44% decline. On the stillbirth rates, there has been a 37% decline. Well, when you zoom in on these graphs, you realize that most of the progress was in the Millennium Development Goals era between the year 2000 and 2015, whether you're looking at maternal mortality, newborn mortality, or the stillbirth rate. From 2016, progress has stalled. And when you look at the stillbirth rates, we've remained static. The dotted lines at the bottom is where we should be landing in 2030. And we have less than 5 years to 2030. Clearly, if we continue with business as usual, we will not be able to achieve the SDG targets at the global level. For the newborns, we need to run 7 times faster. For the stillborns, we need to run 5 times faster. It calls for urgent action. And then when you look at where are these mothers, these women dying, their newborns and stillbirths, regardless of whether you're looking at it from the maternal angle, the newborn angle, the darker the color, the higher the burden of the deaths. And whether you're looking at the maternal mortality, newborn mortality, and stillbirth mortality, or childhood mortality, you notice that the greatest burden is within the sub-Saharan region, but also countries that are affected by conflict and fragile settings. I need to highlight, however, that even in some of these countries where the number of deaths are on the lower side, we still are struggling with huge inequities, where the deaths are occurring within a specified population. And it's important that even in these settings, we address the equity gap. So it's important to know where we are, where we're coming from, and where we should actually be landing. So we're clearly off track. But we did it during the MDG era. We were able to have faster progress. We can actually also do it in this SDG era. And we know that if we invest in pregnancy, we invest round about the time of birth, we invest in care of these women and their newborns after birth, we invest in emergency care and small and sick newborn for these women and their babies, we can save 3 million lives. The bulk of these deaths are actually preventable. And that should give us some glimpse of hope that if we did things right together, we can actually push the agenda forward. And that's why every woman, every newborn, everywhere, a winning initiative is very important. And through this initiative, we are supporting countries to scale up high impact interventions. And that's where these coverage targets are coming from. For us to be able to save the 3 million lives, we need to make sure that at least 90% of every pregnant woman has access to good quality antenatal care. 90% of these women, when they go into labor, they are attended to by a skilled birth attendant. They have proper care immediately after delivery and in the postnatal period, 80% of these women, we need to make sure that in case there is a complication, whether it's during pregnancy, during delivery, or in the postnatal period, these women have access to emergency obstetric care and their babies have access to small and sick newborn care. We do talk about access so much, but access on its own, without pushing the quality agenda, will not be able to give us the impact that we're looking for. It's important, therefore, that we push for access, the 90-90-80-80. But alongside access, we should also be pushing for quality. And that will give us the impact. We can save 3 million lives. Back to you, Femi.
Access plus quality equals impact. Dr. Queen Dube, thank you so much for unpacking the latest data that we have on women and newborns globally. But every data point, every piece of data is actually a real human being story. And we wanted to make sure that we brought that to you in many, many ways, but particularly via Tasmin Bota. Tasmin, it is great to have you here. Thank you so much. Appreciate your patience as we've been listening in to all of the conversations about women and newborns. But you have a story that you want to share. I'm going to tell everybody that Tasmin is the founder and executive director of Preemie Connect. She's based in South Africa. And your personal story is so pertinent to why we're all here today. Tasmin, thank you for sharing it. Please go ahead.
Thank you so much for having me, Femi. I am blown away by the information that has been shared. And yeah, as a mom, I take that role out of all the roles as the most serious of them all. And I am one of the people that had a preterm baby that was born at 28 weeks gestation due to placenta abruption. But I was one of the lucky ones. I ended up receiving the right care at the right time, at the right place in order to save my baby's life. A part of my story that I tend to not share very often is that a few weeks before my baby was born, I was involved in a motor vehicle accident, which I firmly believe correlates to me having my baby born too soon. But they were a few weeks apart, the two instances, so it was not something that we really focused on at the time. And in a matter of a few hours, my world was turned upside down and I was thrusted into a world that I knew nothing about. And this tends to be the case for the majority of parents who end up having preterm babies. I was just lucky that when this happened, I happened to be on the opposite side of town. So I was not near the hospital that I was booked to give birth in. But like I said in the beginning, I ended up being at the right place at the right time. Where I live in Johannesburg, South Africa, we have one hospital that is dedicated to maternal and child health. And that is the hospital that we were lucky to have landed at. And so my baby spent 54 days going through the preemie journey. And to say that you are never prepared for the journey is an understatement. But what a lot of people don't talk about is the journey after discharge as well. And so in hospital, we received all the support that we could have. I always say that I feel our medical team was miles ahead because they already recognized back then that family integrated care was crucial in the survival of our preemie. Kangaroo mother care at that time was introduced once our baby was stabilized. And again, it was another factor that helped me gain confidence in order to be able to take care of my baby. Because at the end of the day, no matter how much the clinicians do in hospital, you are discharging a baby into a community, to parents, to families that know very little, if not nothing at all, of what's going on with this baby's health. And that's where I found myself. After being discharged, I went in search online for an organization where we could find the emotional support that we needed. And it literally took me on a tour around the world, but I was specifically looking for a group based in South Africa. And at that time, I could not find any. And that is when I decided to form Preemie Connect. And through the work that we have done, it brings me to where I am today. But we have gone through many years of providing emotional support, education. I think education is the number one issue for our parents, because we feel like as parents sometimes we're very scared, we're very nervous to ask questions. We feel like what the doctors are saying is the be all and end all of what is going on with our children. And so in the work that we do, I make sure that my parents understand that their voice is just as important as the medical team. And I'm so pleased to see that more and more parents are getting involved. Like just me being here today is testament to the fact that we are being given a seat, that our voices are important, and that sharing our stories make a difference. And it has been 8 years. We have just celebrated my Premi's eighth birthday, and it's been 8 years of us being on this journey. It has been filled with many ups and downs. At 4 years old, my Premi was diagnosed with mild hypertonic cerebral palsy. Another part that I didn't know anything about, but through the work that we've been able to do with Premi Connect, I had already formed a village that was able to assist me. Our medical team till today has been key in ensuring that we receive the right care. We received early intervention from 10 months old already. So my child has gotten those allied health services that he needs, which I firmly believe has made the difference in our journey. I have a thriving, happy, healthy 8-year-old today, which could have not been the case had we not received the care that we received when we received it. And so I'm just very grateful that the World Health Organization and many, many, many other organizations are recognizing the importance of maternal health, the importance of saving our babies, because every baby deserves the right to survive, but not only survive, also thrive. Thank you so much, Femi. Back to you.
No. Thank you so much, Tasman. When it comes from you, when it comes from mums and families, it means so much. It's so powerful. And your energy and your passion is leaping across the Zoom screen to all of us. It's so good. I'm going to make you stay for panel number 2. Are you okay with that, Tasman?
Absolutely. Thank you
All
so
right.
much.
Let me tell you who else you'll be enjoying your company, who will be enjoying your company. We have Dr. Angel, who is from the Ministry of Health in Zambia, Assistant Director, Reproductive and Maternal Health, and also Rachel Durango. And Rachel Durango is the Regional Director, Advocacy and Public Policy for PATH. In this second panel, we are going to be looking at the power of partnerships to implement the solutions, the many solutions that we already know that are possible to create better outcomes for newborns and for mums giving birth to babies the first few months and years of their life. We know we have those solutions, but how do we implement them using partnerships? I'm first going to partner with Dr. Angel because Dr. Angel is going to tell me how to say his last name perfectly. Dr. Angel, this partnership is important. Please go ahead. Please say your last name for me and for all of our attendees in the webinar. Go ahead.
Thank you, Femi. My last name is Muiche.
Thank you.
Yeah, so thank you for the opportunity.
Yeah, and we're looking at the government level here. What partnerships are possible when you're looking after women and newborns with a Zambian perspective? What do you want to share with us?
What I want to share with my colleagues here, part of it has already been touched on. Healthy beginnings, hopeful futures is a powerful reminder for our collective responsibility to ensure the very best start for every woman, every newborn, everywhere. And it does not only end with healthcare workers, it does go to social scientists, politicians, and everybody else. What we see in Zambia is multi-sectoral, multidisciplinary collaboration with an enabling environment created for implementation of high-impact interventions in healthcare, high-impact interventions in education, high-impact interventions regarding nutrition, as well as water and sanitation, for the benefit of every woman, every newborn, everywhere. And what we see with that kind of partnership is a reduction in maternal mortality by 25%, recent data, and 37% reduction in neonatal mortality. And believe me, we can do better than that with stronger partnerships and stronger collaborations, as well as multidisciplinary interplay. Over to you, Femi.
Thank you, Dr. Angel, for giving us that government perspective from Zambia. Civil society organizations are so critical for what we do with our little ones and with our mothers in the community. So they have a particular insight into what do we do now that funding is really tough. It can't be just we can fund all of these solutions. How do we implement them? How do we partner with civil society? What is the top ask, Rachel? How do we reprioritize what we need to get done?
Thank you, Femi, and everybody else. Happy World Health Day. And I think, Femi, you really ask a very important question at a time when funding for health is really facing huge threats, especially in the lower and middle-income countries and sub-Saharan Africa, where which accounts for majority of the maternal, newborn, and child health, as we've heard from the data that has been shared today. While we say that again, it's critical to note that spending for health, and especially domestic spending in the Africa region, is really, still low. And so even as we are talking about the current situation and how we respond to accelerate action for women, for mothers and newborns, we really need to ask ourselves, where then do we put the monies that are needed to be able to accelerate progress? And speaking from an African regional perspective, as a key ask for now, and also from the advocacy community, is really for governments in Africa, especially with support from regional institutions, the global partners, including those in the room today, to really prioritize and protect investments in maternal newborn health. I think maternal newborn survival and well-being should not be compromised by the shifting financial priorities at the moment, but rather we really need to sustain investments to protect the gains that we have made and be able to accelerate the progress. Looking at the shifting health landscape and this data that we've had today, I think this really should spur renewed commitment, right? And strategic action and robust partnership to be able to help drive sustainable improvement. In the Africa region, where PATH works in a number of countries, alongside other advocates, we acknowledge the progress that has been made. And it's very refreshing to hear, the commendable progress. But at the same time, we call upon leaders, including institutions like the Africa Union Commission, to really leverage existing and promising initiatives in the region. For example, the Karma campaign. We have platforms such as the Global Leaders Network for Women, Children, and Adolescent Health. We also have the Network of African Parliamentary Committees of Health, which can really help to mobilize resources, mobilize political will, but also really drive smarter investments in health, ensure financial sustainability, and also just ensure that we are scaling up impact and cost-effective solutions that drive, lives, saving lives for women. But we must say that underpinning this ask really is a critical role of civil society, including local communities, in advocating for change, in pointing to where our prioritization need to happen. And I think as advocates globally, regionally, and the country level, it is important now more than ever to have a unified voice and apply joint strategies to advocate for prioritization, for effective partnerships, and for scaling up of innovations. And so for me, it's really a call to collaborative efforts. Let us evaluate. We do have solutions. We do have interventions at work. That is where we need to be putting the money to be able to scale and save the lives of women and newborn in the continent. Thank you. And back to you.
Thank you. Thank you so much, Rachel. Don't go away. I'm going to come back to you in just a moment. But I'm going to return to Tasmin, who told us her story about, she calls her son my preemie. She told the my preemie story, which means that she's got real insight into what it's like to experience complications at birth. So what would you recommend, Tasmin, knowing that, and also from the advocacy that you do, what would be critical actions as far as you're concerned to accelerate the support we're able to give to women and newborns?
I definitely think that communication is key across the board, whether it is the patient that's receiving the care, whether it's the clinician that is giving the care. If we can communicate effectively, it takes out all the unnecessary fear factor that comes into it, because most of the time like in my case, it's an emergency situation and there isn't really enough time to communicate what's going on. But in order to ensure that patient knows and understands and what the risks are, I definitely believe starting with communication, especially communicating in a language that the patient can understand, is also very crucial. I've seen lots of times where information goes over a parent's head just because they are not being communicated in a language that they understand. I mean, I come from a country where we have 11 official languages, with English not even being, at the top of that list. And so I feel like that makes the difference, and is a key starting point in ensuring that parents understand what is going on with them. But I think also early intervention, that's why it's so important for us to, something I preach even now, we are branching into the antenatal space, because it's so important for women to understand what is happening with their bodies, to be aware of signs and symptoms. And the earlier that we start receiving our antenatal care, the earlier issues can be picked up, and in a lot of cases can be prevented. So we can prevent issues. We can prevent the maternal, mortality if we are doing what we should be doing as the individual as well. I think it's just like we keep talking about multisectoral. It starts with us as the individual that requires the care as well. We need to stand up for our own health and our own care. And I think from there, the communication comes into place, and receiving the correct information. And, we're able to scale up if you need to be sent to a specialized unit if you're having complications. So yeah, I think communication is the starting foundation of it all.
Yeah, I love this. So this is our Levering Partnership panel. So we've got a government representative, we've got civil society, we've got a mum who's experienced complications at birth. So that's the partnerships that we're sharing with you. But let me ask you, panel, one critical action to be done in the next year. If we could have that power, we have that power as a community, what would be that one critical action? In a sentence, Dr. Angel, one critical action in the next 12 months. What would you recommend?
Thank you once more, Fanny. That one critical action that we need in the next 12 months is to strengthen district level capacity for implementation of high impact quality interventions. We need to train the healthcare workers, capacitate them, support them, as well as give them the support to use quality data for planning and decision making. In that way, we will have brought the services closer to every woman, every newborn, everywhere.
Everywhere. Yeah. We're all going to be saying this. Thank you so much, Dr. Angel. Rachel, one critical action must have in the next 1 year, next 12 months. What is it from your perspective?
Thank you, Femi. First of all, we must protect, the investments that have already gone into maternal and newborn health, but we also must increase to make sure that, the local high impact interventions from vaccines to bundles of care for prevention against, causes of maternal death and newborn are scaled up and are made available to every woman and every child everywhere. Thank you.
Thanks, Rachel. Tasmin, I feel like I've been asking you so much. This is one last question, though, to get this out of you, which is in 1 year, in the next 12 months, what would be top of this is the one critical action? Is it communication? Have you already shared it with us, or is there something else?
I would have to go back to what Dr. Queen said. Access. Access makes all the difference on whether you will survive and thrive. It's sad to say, but it's the reality of the situation. And just like Dr. Angel was saying that we need, more healthcare workers. What happens to the mom in the rural area that can't get to a level 1, level 2 hospital? So yeah, access for me would be key. That's what I'd like to say.
Thank you so much, partnership panel. It was a good partnership between us for panel number 2, leveraging the partnerships to accelerate and implement the solutions that we heard in part 1. We have around about 300, maybe 400 people that I can see actually on this Zoom webinar. There may well be more watching on YouTube and following elsewhere. But I'm going to ask you this question as well. What gives you hope? Those healthy beginnings, hopeful futures. What gives you hope on World Health Day? Please put your response in the Zoom chat, and it'd be really good to tap some of your energy as well. What gives you hope? And also, what would be the critical action that you would recommend as the MNH community for the next 12 months? Because we have to do this together. All right, we complete our webinar today with Dr. Kim Mambo. She's the WHO representative in Malawi. She joins us live now via our Zoom webinar for our call to action. What do we need to do? What are you asking for us to do? Dr. Kim Mambo, over to you.
Thank you, Femi. Wow, this has been really exciting, inspiring, and I hope we are all reinvigorated and, we all feel like we are ready to renew our commitment to accelerate reduction in maternal and newborn health. So I'll just first like to summarize just some of the key things that we've heard today. It's exciting that there has been progress when we look at the data from 2000, that we have seen progress in reducing maternal and newborn health, newborn mortality, as well as mortality among stillborns. But yet we've seen that the progress is not adequate to get us to the SDGs. And with the current changing landscape, it's really important that we're able to work together to support women and babies who are the most vulnerable. So we've heard in this past hour, we've heard from leaders, decision makers, advocates, workers, families, mothers, and we've heard of some solutions that are being taken and implemented to move things faster and to be able to save the lives of women and children. We heard about the EWIN, the Every Newborn Everywhere, every woman, every newborn everywhere initiative. which is co-hosted by WHO, UNFPA, and UNICEF. We heard from our leaders, but we also heard from Nepal and Zambia, from Dr. Bibek as well as Dr. Mwiche on these are 2 countries among the 50 countries that are already prioritizing survival for women and children through this initiative. And I think we've heard the issue of prioritization coming up. We also heard the issue of multi-sectoral response, that it's not, you cannot fully achieve our targets if we're just going to focus on the health sector. So we heard about, ensuring a multi-sectoral response is very critical for us to be able to reach the targets. The UN targets, we heard of the 90-90-80-80, which, we should all continue to strive to achieve. And it's not just about the access, but we heard about access and quality is important for impact. I think also from the health worker elements, we heard about the importance of health workers, about leadership, and we heard about the midwifery accelerator and midwifery model. So also the emphasis on midwifery on this. We heard from civil society and the importance of really hearing about voices from the communities. And it's not just a matter of hearing their voices, but when we hear their voices, then it helps us to identify the gaps and the areas where we can work for impact and improve and impact based on the gaps that they have said. So we clearly see that, we have UN partners and partners supporting countries in this every step. We know that partnerships work within the UN and beyond the UN with the government. So just a call really along all those areas that I've mentioned, all these things that we have heard here today, as we kickstart this campaign on healthy beginnings and hopeful futures. I hope that all of us will work together to advocate, to invest, and to act together so that we can improve the lives of mothers, we can improve maternal health, and we can improve newborn survival. So as we take part in this campaign, whether it's in advocating for quality of care, whether it's sharing your personal experience, which is so important and so touching, as we did get from Tasmin, whether it's ensuring that people have the right information, let's all to work together over this next year to accelerate and ensure healthy beginnings and hopeful futures for mothers and newborns. Thank you. Back to you, Femi.
Dr. Kimambo, thank you so much. If you have your mobile phone handy, which I know most of us have within arm's distance away, look at the QR code, have a look at it through your camera app, and you will see it will take you to the Healthy Beginnings, Hopeful Futures campaign site. So you can go over lots of the incredible information that has been shared with us today. Thank you for spending part of your World Health Day with us. Thank you, speakers. Thank you, attendees. We really appreciate you. On behalf of the co-chairs of the initiative, the WHO, the UNICEF, and the UNFPA. Take care, everybody, and make sure you do what you can for healthy beginnings and hopeful futures to accelerate the global action to support women and newborns around the world. My name is Femi Oke. It's been a pleasure being your moderator. Take care.